When cleaning a plastic tracheostomy tube, you will need the following items: dish soap, fragrance-free preferred, hot water, 2 glass containers, obturator, tracheostomy tube brush or cotton tip swab, hydrogen peroxide, distilled water, plate, clean paper towel, gloves, optional. A few notes before starting. Before beginning, it is advisable to wear gloves. This will help reduce any possible contamination by a person's hands. Also, during the entire process, please only touch the tracheostomy tube by the connector or by the phalanges. Do not touch any other part of the tracheostomy tube. Additionally, when touching the obturator, only touch the outside rim of the obturator. When cleaning a tracheostomy tube, please use glass containers if possible. Glass containers are non-porous and have a low likelihood of harboring bacteria. Plastic containers are porous and can harbor bacteria. When cleaning a tracheostomy tube, please use fragrance-free dish soap if possible. The strong perfumes in many dish soaps can linger on the tracheostomy tube even after it is cleaned. Breathing in the fragrance is very irritating to the airway. When using hot water, please never use the hot water from the tap. There are many bacteria which live in the hot water lines, one of which is Legionella. Legionella thrives and multiplies rapidly in water temperatures of 98 to 109 degrees Fahrenheit or 37 to 43 degrees Celsius. Exposure to Legionella can cause Legionnaire's disease, which is a severe form of pneumonia. If using hot water from the tap, you may be exposing the tracheostomy tube to the bacteria. Hopefully, the Legionella is killed by the soap in disinfecting the tracheostomy tube, but please be safe and do not use hot water from the tap. Instead, fill a pot with cold water. Heat the water in the pot to 110 degrees Fahrenheit or 45 degrees Celsius. Alternatively, you can put cold water into an electric tea kettle and heat the water to 110 degrees Fahrenheit or 45 degrees Celsius. From my experience, the cotton tip swab does a poor job cleaning the tracheostomy tube. It cannot bend and reach inside the tracheostomy tube. The tracheostomy tube brush does a much better job of cleaning and can reach the entire length of the tracheostomy tube. Tracheostomy tube brushes come in different sizes and are available through many medical supply companies and can also be purchased online. The tracheostomy tube brushes can be washed, sterilized, and reused. Wash your hands thoroughly and put on clean gloves. Using a clean glass container, place a small amount of fragrance-free dish soap and hot water in the container. The water should be about 110 degrees Fahrenheit or about 45 degrees Celsius. To clean the tracheostomy tube, push the obturator through the tracheostomy tube. This will push out any mucus which may be inside the tracheostomy tube. Using a clean paper towel, carefully wipe off any mucus which might be on the end of the obturator. Next, remove the obturator. Place the tracheostomy tube and obturator into the soapy water. Allow them to soak for 1 hour. An extra step which may be taken is covering the container with a lid to prevent anything in the air from dropping into the container. After 1 hour, carefully remove the tracheostomy tube and clean it with either a tracheostomy tube brush or a cotton tip swab. Gently swirl the tracheostomy tube around in the soapy water and place the tracheostomy tube back in the soapy water. Next, pour 1 part hydrogen peroxide and 1 part distilled water into a glass container. Rinse off the tracheostomy tube and obturator with water. Place the tracheostomy tube and obturator into the hydrogen peroxide solution. Allow them to soak for at least 1 hour. I usually soak my tracheostomy tube for 1 day. An extra step which may be taken is covering the container with a lid to prevent anything in the air from dropping into the container. Before removing the items from the hydrogen peroxide solution, place a clean paper towel on a plate. After soaking the tracheostomy tube and obturator, Place them on the clean paper towel. Dump out the hydrogen peroxide solution and fill the glass container with distilled water. Place the tracheostomy tube and obturator in the distilled water and allow them to soak for 10 to 15 minutes. Remove the tracheostomy tube and obturator and place them on clean paper towel on a plate. If the tracheostomy tube is going to be used right away, it is now clean and may be reinserted. However, if the tracheostomy tube is going to be stored away for a later use, loosely cover the tracheostomy tube and obturator with a paper towel and allow them to air dry. This will take several hours. To ensure the items are completely dry, I let them dry for 24 hours. When the items are dry, carefully wrap them in a clean paper towel and place them in a plastic zip-top bag. Please note, according to most manufacturers, a plastic tracheostomy tube can be used for up to 1 month. After 1 month, the tracheostomy tube should be discarded and a new tracheostomy tube should be used. After using the tracheostomy tube brush, rinse it off in water. Pour out the soapy water in the container used to clean the tracheostomy tube. Rinse out the container. Place more fragrance-free dish soap into the container. Add hot water, which is about 110 degrees Fahrenheit or about 45 degrees Celsius. Swirl the brush in the water and allow the brush to sit for 30 to 60 minutes. Heat up a small pot of water to a boil. Rinse off the tracheostomy tube brush in water and place the brush into the pot of boiling water. Place the lid back on the pot and turn off the heat. Allow the water to cool to room temperature. When the water has cooled, place a clean paper towel on a plate. Remove the brush from the water and set it on the paper towel. Loosely cover the tracheostomy tube brush with a paper towel and allow it to air dry. When the items are dry, carefully wrap them in a clean paper towel, place the clean brush in a plastic zip-top bag, and store it away for future use. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!